Earlier when we were talking, you had mentioned, that your patients and part of your programs is a support system and building that in. And just saying to patients, you don't have to do this alone, I think is very comforting, especially when we're talking about health. For your patients right now or potential patients who are struggling in silence, what would you say to them?
I would say that even though they've been told likely that there is no solution and they just have to put up with it, and the only option is medication and or higher doses of medication, that is very unlikely the case, and that they need to advocate for their own health. They need to find the sort of clinician like root cause where we fight for you as hard as you fight for you. And I've had so many patients who have said that, you gave me that support to keep going. I kind of wanted to give up. And, kind of goes back to our core values of giving 110% and never giving up. Patients feel that. And they realize that we've been doing this for over 30 years, and that gives them confidence and the support to carry on. So I would say absolutely don't give up. And one thing that's unique about us, Sarah, is really a couple of things. But one, we do this complimentary consultation, and we don't take on patients we don't think we can help. So that's what was nice about that half an hour consultation, of really getting an in-depth history, because I'm looking, and very often patients have felt like they've done everything they can possibly think of. They're coming to us as sort of the port of last resort. And so I always tell them, okay, if I don't think we can help, we won't take you on as a patient. But I'm going to do a really in-depth history, because I want to know what you've done, and I want to see if there's any holes in what you've done that are obvious to me. So these are areas that have not been looked at. And if I find those, then we should go forward. If you've done everything I can think of, and this doesn't happen very often, then I'll let you know that too. So it's a very safe place to kind of do this exploration. Because the other thing that happens too often is that as soon as someone doesn't fit into a box of a certain diagnosis, they're told, you're under stress, here's your antidepressant, here's your anti-anxiety medication, and they're just pushed off as it's all in their head. And that's just not the case. And that's something we do see a lot, and it's really unfair to individuals who know what they're feeling and they know how miserable they are. They deserve help, and that's what we want to do.